it's a great pleasure to have you here. I know it's been a long day, but it's been a very productive day, so we're very, very happy you're still here, and we'll do our best to keep your attention. And just as an briefly introduction, we would like you to join the discussion as much as possible. Our colleague David Bruna is distributing you a proposal, an advocacy plan about the next steps that the Rome Consensus Initiative should take between 2023 and 2026, so the next 3 years. The panelists of this session will be Reverend Martin Diaz. I have the pleasure to introduce him. Martin is a theologist and a Protestant priest. He's the CEO and co-founder of the Nomad Institute, a European Institute for Multidisciplinary Studies on Human Rights and Science-Based. They are based in Brandenburg, Germany. But Martin was born in El Salvador, so he's from El Salvador. Martin is also a One Young World Ambassador since 2021. And I have to say he's been one of the most active leaders among the Rome Consensus Task Force since 2020. And last but not least, he's also a social researcher on human rights. I would like to start by saying that the Nomad Institute played key advocacy role in the last 3 years, spreading the Rome Consensus Initiative literally across the globe. So it's really, really important to have the Nomad Institute here today. And just to mention a few of the most recent key actions promoted by Martin and his team to spread the humanitarian drug policy. First of all, he presented the Rome Consensus during the One Young World Summit back in 2021. And it's a really, I'm not sure if you're familiar with the One Young World Ambassador program, but it's a really wide network, very inclusive. There are ambassadors pretty much from all over the world, and he managed to have 22 ambassadors of this program signing the statement of the Rome Consensus. And this was a really, really significant move, because this happened, right after the pandemic, and we were kind of stuck because, as everyone else in the world, so we couldn't really do much during 2020, and this was one of the first significant actions that we, and achievement of 2021. Martin also, played a significant role by publishing many articles among the international press. So we have a really good press release that you can check out on the Rome Consensus website. It's in the newsroom section of the website. And one article in particular, actually 2 articles in particular, one about a humanitarian intervention in the war on drugs, and another article about how to win the war on drugs by implementing humanitarian drug policy. It was all over, literally. It was published by several newspapers in Europe, Latin America, Middle East, Asia, and it was translated in several different languages, including Arabic, Russian, and Chinese. And you all know how, this was huge. So thank you so much, Martin. We were also able to have him participating as a panelist in one of the last side events that we presented during the last Commission on Narcotic Drugs at the UNODC in Vienna. And his intervention focused on how to use the Rome Consensus 2.0 initiative as a pragmatic tool to deliver universal health coverage worldwide. And that's when we also had the endorsement of the government of Colombia and the government of Italy. And we're very, very thankful for this. So today, he will present a proposal, an advocacy plan, an advocacy and communication strategy plan to ensure the development and maximization of the Rome Consensus impact globally. Reverend Diaz, thanks again for being here today. The floor is yours.
Thanks. Thanks, Romina. You can hear me? Yes? Okay. So, how it work this?
Can I help you?
Okay. So, first I want to say some activities that we make from 2020. First, the relaunch of the Rome Consensus. We make also a translation of the statements in more than 6 languages. Also, we public key recommendation for staff and volunteers on health services in the COVID outbreak in 3 languages. In 2021, we make 2 side events, one in the CND and one in the Commission of CCPG. Yeah. And about deflection. And also we participate in the Overdose Awareness Day and the Support Don't Punish campaign. Also the campaign with the One Young World in the One Young World Summit. We try to have endorse and engage with ByteDance, the company who owns TikTok, to support with some special issues in their platform, but we don't achieve that goal. Also in 2022, we make 2 sites events, and we publish these articles in several countries that I think it's good to show that some governmental media from, for example, Russia, Bahrain, and Singapore published the article. And I think this is a good issue because, you know, some of these countries have death penalty. And if the official media publish this kind of things, I think it's good because they are looking at us. And this year, we also present global deflection as a new policy in CND, and how Rome Consensus 2.0 can be a pragmatic tool for the reform. And to have this proposal, we propose these 10 points to work in the next years. But first, it's important to have a mapping and diagnostic of where we are. And we see the 55% of the organizations are not part of the Red Cross and Red Crescent. I guess this is important because we have a big network inside. The majority of organizations are health service providers and harm reduction providers. We also have international non-governmental organizations, NGOs, academics and research institutions, public institutions, and you can see there the diversity. And also, if you want to explore the map, you can scan the QR and explore more detailed. The thing is, we don't have, we need to verify who is engaged the Rome consensus. And it's important also to see that we need more organizations from the Global South. It's important because the majority of signatories are part of the Red Cross. And I think that is an important challenge because, you know, in the tropic French, we have the red dot of violence related to the war on drugs, so that's important also. And the steps.
Can I add something about the map, please?
Yep.
So this is the very first time we are showing this map, so it's not on the website yet. So it's the very first time, and as Martin was explaining, basically this is the list of the over 700 organizations that so far signed the Rome Consensus 2.0 statement. So one of the issues that we're facing, and that's why we would like to get your feedback during this session, is so how can we engage with signatories? So it's great that they put their name, the name of their organization there, and they say the Rome Consensus is a great statement. So let's sign it. But what happens next? So how do we keep these organizations engaged? And this will be part of the debate during today's session. So thank you, Martin.
Thank you, Romina. Yes, that is really important, and we need to have a better communication with our network, because now I think we have only one-way communication from the Rome Consensus to the network, and if we want to make a real change, we need to mobilize, and we need to have a real good communication. And to that, we aim to establish a stronger relationship with our global partners and promote collaboration and joint coordination to advocate humanitarian drug policy in the national, regional, and international level. This is our proposal, like, to start to work, like mobilize allies, and the first is establish a stronger partnership and advocate, but we are not seeking to do or to create new things. You have a lot of work, so we need to, you think how you can use the Rome Consensus and how the Rome Consensus come to your work, and coordinate some specific actions together to make more visible.
And the fact that we are here today, it's actually the first step to move forward. And again, we know everyone is busy. Everyone is here representing an organization, so we know you're already doing a lot in this field. So I promise we don't want to have you working more or assigning you new tasks or anything. We're just asking you to make this networking work together, and basically combine the expertise, combine the resources, because, for example, this is just an example. Every one of us is doing something with his or her organization on World Drug Day, June 26. I'm sure everyone, right? So the goal would be to join, the resources and do something together. Nothing new, just what we're doing, maybe doing it bigger, better, but just doing it together. So there will be examples during today's session. So we will explain these and get your feedback in a few minutes.
Yes. So we are thinking in have some key international events like we can work together. So we propose the Munich Security Conference because from 2020 they start to talking about health like a security component also. And I think this space is one of the most important worldwide about security. And if we can put in that place the issue of the we need to finish the war on drugs and have a global health access, we can have more impact than in the traditional international forums because they don't have only the participation of the governments, but also of the companies who have more influence in the governments, you know. Also, the 67th Commission of Narcotic Drugs is a key event because it's the midterm review, and I think the majority of us make side events and work in the CND. So if the next year we can talking about in our side events in some way about ROM consensus, and we can use the ROM consensus like a co-host of our side events, we can have a real impact because the public servants can view the omnipresence of the ROM consensus there the next year. That I think is really important, and we can do because we have the network, and we know how it's worked there, and if we want, we can do this because it's easy and we don't have any new resources of anything. We have the tools, so we only need to have the real will to do this. And in the 68th Commission of Narcotic Drugs, we propose to have some specialized publications who can validate all we talk in the ROM consensus, and I think this is really useful because the open science and the research is an important part to have evidence-based policies. And finally, we proposed the RightsCon in 2025. This is one of the most big human rights conference related also with technology. And it's different of the public that we engage normally. So we can have also an impact in the tech companies about these issues that we are promoting a humanitarian drug policy. Also, we think we propose these dates that like to have some permanent presence in activities in the network. I think all of us have some activity around June 26, but the other dates are also important, and we can do some short activities based obviously in the communication. We can spread a real good press releases if all the network are compromised to disseminate in their own countries.
Yeah, Martin, exactly. And so this is just an example. Again, it's a proposal. So if you have other key dates in mind, please feel free to tell us and interrupt us at any time. And so, Martin, why do we need to share a calendar of key dates with all our allies and supporters? Like, how does the call of action work on these dates? Again, we don't need to do new activities. There's another example, for example, I think it was back in 2022, we joined the Support Don't Punish campaign, and we basically was a co-branded campaign here in Italy with IDPC and Support Don't Punish, and it was, of course, for us it was great because Support Don't Punish is much, much bigger than Rome Consensus. But on the other hand, you know, we are part of a really, 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 really wide network of Red Cross and Red Crescent national societies, so we can, you know, involve them in some kind of other co-branded campaigns along with, you know, Rome Consensus and your organization. And yes, please.
Yes. So we can do, for example, also videos in the social media, or even a post like all of organizations can publish the same day. That is something. And the idea is have a permanent actions. And also, if you have in your region or in your country an activity that the network can be disseminated, so please, that is the point of work together and stay here today. And like Romina said, this is only a proposal, so you are welcome to say and propose another things. Finally, we see some key intergovernmental organization that, because it's not, we don't like to see only the UN and the Organization of American States. We also see the system of Central American integration, the Caribbean and Latin American organization, African Union, and ASEAN. And because they are all have a specific units or office related to drugs and health, or actually security. So we have the network in all these regions, so we can also activate the advocacy work in these places. Also, if you have another organization that maybe is key, we can add it. And also, for example, a few days ago in Latin America, some countries start the Latin American and Caribbean Medicine and Medical Devices Regulatory Agency. And I say this because also the humanitarian drug policy and the access to the medicaments, we need to think also in the access of medical technologies, because this is also an issue.
Yeah, so before we jump into the working groups activities, I wanted to mention something that we started to do back in 2020. So again, when we're stuck because of the pandemic, through our newsletter, we launched the Rome Consensus 2.0 Ambassador Program. So basically, we were seeking for ambassadors in the countries where we have organizations that are already supporting us to become an ambassador, meaning that this person will be the reference point in each specific country to advocate and promote humanitarian drug policy and the initiative, the Rome Consensus initiative. So of course, 2020 was not the ideal time to do something like that, because of course we couldn't meet anyone in person, we couldn't travel, attend conferences and do networking. That is a crucial component of any advocacy and communication strategies, but we started little by little. So for example, in Greece, our ambassador, who is not here today, unfortunately, Marios Atsemis, he was actually the very first one. So Marios, did some advocacy work in Greece. He's from Greece. He also attended our side events in Vienna. He was one of the speakers during the last side event back in March. And then we also have some key regional partners. For example, we have Eli Haraj from Lebanon. Eli is the director of Menara, and Menara is a pretty wide network working in the Middle East and North Africa region. We have Milutin Milosevic. Is based in Serbia, but is coordinating a network of NGOs in Eastern Europe. So we started little by little, but we started with some of the best key partners that we could possibly have. So thank you, Eli, thank you, Milutin, and thank you, Mario, even if he's not here today. But of course, we need more. We need more ambassadors, and our hope is that once this event will be over and everyone will return home, you are willing to become the Rome Consensus ambassador in your country. Of course, I mean, it's an ambitious plan, but now the network, is pretty wide. Again, over 700 organizations signed the statement so far. It's significant and it's growing. We see every event, international event where we're getting, more allies, more supporters. But again, it's never enough because humanitarian drug policy. It's still, especially in some countries, it's still kind of taboo, if I may say. And of course, we're not present everywhere in the world. And again, there are like countries where it's really, really, it's not easy to promote humanitarian drug policy, deflection, and so on. So we need your help. The aim of this, exercise that we want to do together today is, the goal is basically to try to identify and include the Rome Consensus initiative in your organization, networks, regional or national advocacy plan. I'm sure you all have already an advocacy communication plan in place with your own organization. So what we would like to do today is divide the room in 4 smaller groups. The division would be geographic, just because, of course, it's a lot of us, and it's more strategic to divide, the room in this way, because again, we hope that among yourself and together you can join resources and you can share ideas. So we expect, that this group will be working for the next 20 minutes or so in 4 different groups. So one with the representatives from Africa, one with the representatives of Americas, then one for Europe and one for Middle East and Asia. So again, what we're asking you today, it's not a formal commitment, but it's a starting point. So we want to start working with you all. And so the goal of this activity is, again, identify at least 2 actions to carry out during one of the key dates that we listed in the previous slides, or if you have another key date in mind, that would be a great date to celebrate humanitarian drug policy. Please include that in your, yes, Jamie, I see you have a question.
I was just wondering, before we split into the regional groups, whether there'd be a moment just to make some more broader global comments about the slides and the presentation?
Absolutely,
and the
absolutely.
We have. I think that might give people ideas for the groups as well, possibly.
So maybe, actually, this is a great point, Jamie. So maybe what we can do, we can start, because this will help you maybe to better understand, the exercise and what we would like to, get from this session. We can start. I haven't asked you yet, but do you have any questions so far? Not about this exercise, but in general about the Rome Consensus, the network, and what we're willing to do with the advocacy plan that has been presented. Fabio, do you have a question?
Yes, it's a consideration. Being the fact that we have this list of all the signatories and distribution in different countries, it could be an idea to identify one country for region, for example, in which we see that there is a great number of institutions already committed to the point, in order to stress more as a pilot country or area, I don't know, to concentrate more efforts?
It's a great point. Please.
I have a doubt with that, because in making the map, the most signatories are from France. So I don't know, it's we can use and I say this like a Latin American. I don't know if a European country was the best pilot, So, but I understand your point, but I don't know if this is the optimus approach. I don't know.
Only as one option, not to be exhaustive of all the energies, being the fact that we have limited energies. So if you have already a situation in which there are concentrated energies.
Yes. France is the country where we have more organizations, signatory organizations, actually.
Just one sec, Ellie. I give the... okay, sorry. Ellie, please go ahead.
Thank you, Jamie. I'm thinking loudly, excuse me, and you correct me if I'm wrong, but I don't think the aim is to have thousands of signatures on the Rome Consensus declaration. I think our aim is to get into more advocacy and to have and to start seeing policy change. As you mentioned, Romina, all of us have our own action plan, our own advocacy activities. The support don't punish is one of them. How can we merge these activities with the declaration? I don't know. And if we want to have something similar or something related to other activities, advocacy activities, I think this needs a budget, because if I have partners in any country of the region and I ask them to advocate for their own concerns, it's not only about having meetings with here and there, but maybe they need to organize a campaign, they need to, so I'm not sure if we have a plan to get a budget to support the partners in implementing advocacy for this declaration. On another hand, if you divide this the meeting in regions, I will meet with myself, because I'm the only one from the MENA region.
Actually, we combine Middle East and Asia together, so you should not be the only one.
So now you are following the UNAIDS model.
Exactly. Thank you, Ellie. Jamie, please.
Okay, thank you. And yeah, I'm glad I let Ellie go first, because I think the value, the strength of any consensus project like this one is actually in the signatories. You know, that you can have the best document in the world, but if only 3 people have signed up to it, then what does it mean? So I actually do think the target is to get thousands and thousands of signatories. I think that's what gives you strength when you then present this. So, because it's not really, I mean, first of all, thank you for this. It's great to see. And you know, it's not really written in here, but I assume that the target for all this communication and advocacy is that we want to grow the number of signatories. We want to reach every country and fill the gaps that we've got in the map. You know, and then we want to take it to policymakers, and we want them to listen to us because we are saying this has been signed by thousands of NGOs from 180 countries around the world. That's what gives it the strength. In the same way that the UN Common Position, the strength of that document is the fact that the whole of the UN has supported it. It's all about who the signatories are. So for me, I think that is a really important focus. And I think with the communications work that you've done, the great work that you've been doing, you've got 700 signatories already. Most of them are probably organizations inside of the bubble, you know, organizations that we know. I think there's, you know, we now have to do outreach. I think everyone who is going to naturally find the Rome Consensus themselves has already found it. You've been to CND, you've done the social media stuff, you've promoted it really well, translated it into 6 languages. It's great. So I think the next step is to do the outreach and to reach the new groups. And that includes groups that might not think that they care about drug policy. You know, we talked yesterday about the teachers' unions, the doctors, the nurses, the police, you know, all of these groups, getting them on board as well. So I think that does need more proactive outreach and a more targeted kind of approach. One place you could start is to get the list of all the ECOSOC accredited NGOs and start going through that list. Don't contact them all, it's impossible, but you start going through that list and start just noting which of the ones you think would be really good to invite. The International Federation of Teachers, the International Federation of Nurses, those kind of things. Map out all of those, add those to the mapping as well, and then try and reach out that way. So that, because the strength of the signatories I think it's partly numbers. I think you do want thousands and thousands of signatories to this. But it's also about who those signatories are and the profile of those signatories as well, and how broad those signatories are. So that's the first thing I wanted to say. The second thing, in terms of the target dates and the plan, we've got a few others. I won't go through them all now. We'll just give you, add some ideas to the list. But one of the key one is something that Zabed mentioned yesterday, which is that the Office of the High Commissioner on Human Rights is producing a report on human rights and drug policy. And there's an open invitation for all NGOs to make a submission by the 21st of May. So pretty soon. We should just submit the Rome Consensus. That's the kind of thing we should be submitting it into that so that it's taken into consideration by OHCHR. And a lot of those submissions are then referenced in their report. Yeah, that's what's happened in the past. So again, it's just another way to feed what we've already got into a process. So I wanted to put that on the radar. And we've got that list, as I say, that list of different commemorative days, and there's some more we'd want to add. I think really that's where the social media comes in, because you're asking, how do we involve the signatories? How do we mobilize this kind of network? You have to be realistic about what you can ask them to do. Like, as Ellie said, if you ask them to do an action or to invest lots of energy into it, they're going to need budget. And you mentioned Support and Punish campaign. We do provide small grants, about 200 small grants a year to people to do campaigns on that day. Being more realistic, given the resources that we have, it's on that day that you could ask people to, you could do like a social media frame for a profile picture that says, I've signed the Rome Consensus. You just use that day on social media for people to do something very easy. It takes them 2 minutes. But if you can get hundreds of people to do it on World AIDS Day or whatever other ones are on that list, then it spreads the word and you use the hashtag and you get that kind of coverage that way, kind of thing. So I think that's how you use those days, rather than trying to ask people to do events and things like that, because that is difficult, particularly if you're trying to do 100-odd countries around the world. The third thing I wanted to put out there, the third and last thing, I promise, was something that I've spoken to a few people about, because I think we're at this stage where we've got the Rome Consensus, we've got the document, it's fantastic. I think it would be a really nice idea, and I know we have talked about this before, the Rome Consensus, the document you've all got in front of you in your packs, it actually ends with, I think, 12 or 14 or something recommendations, yeah? So I think it would be a really nice project and a nice way to involve partners in the country and also involve the national societies as well. What we could turn that into a checklist, yeah, a very simple checklist, an online survey or something like that, and ask everyone to complete it for their country. How close is your country to achieving what we have set out in the Rome Consensus? Yeah? And this could be something that you then pull together. And I think this is all relatively realistic. It's quite low threshold. You know, it's not, I'm not talking about a full academic piece of research. It's, you know, but you could then pull that all together and present that at the CND in time for the midterm review next year. And you could show this global picture, or as close to a global picture as we can achieve, of how close or how far are all of these countries away from the Rome Consensus. It's not hard science. It's not, you know, we wouldn't submit it to the Lancet, but I think it would be something that would be useful. It's a way to engage people, get them thinking about the document as well. And it also, I think it will also help people to understand what the Rome Consensus means in practice. What does it actually look like if it was to exist? I'm also intrigued to see who comes highest, who is closest to the Rome Consensus in real life, because no one will get 14 out of 14. Of course they won't. So I just wanted to, I mean, that's why I wanted to go before the groups, because I just wanted to see if that was something people liked, that idea, or whether there was interest in that, because I think that's something that, it's just something a little bit different, but maybe will help with us reaching new people and promoting this a bit further and saying something new, having something new to say at the CND next March.
Absolutely. Thank you, Jamie. Thank you, Ruby. Please go ahead. And then I will back to your comments.
It's kind of just adding on a bit to what Jamie was saying. And you mentioned about how we can bring the Rome Consensus to different fields, to different groups, like teachers, nurses, these different people. And I think something that could be important for the Rome Consensus is tailoring it, making like tailored messaging packs of how to communicate the Rome Consensus to these different groups, why they should care, why it's important to them. And then those messaging packs or tailored messages can get them to get on board with the messaging. Because if we were to take the Rome Consensus and bring that to certain groups, they won't be able to see how they connect with it. But being able to, tailor the messaging and come up with tailored messaging for these different groups that we want to target, so that we can take this and talk in the language that they would understand, and then they can connect to the message behind it as well. Yeah.
These are really, really great inputs. And just to, briefly comment, because I would, like to, of course, follow up with you later and go into more details, but just very quickly. So starting from you, Ruby, it's a great idea, and we know it will be, be a successful idea, because we managed to, so far, to implement this idea only within the Red Cross, Red Crescent world. Basically, we try to provide the information, a sort of like toolkit, nothing too complicated, because, there are like millions of Red Cross and Red Crescent volunteers, but very, very few know about drug policy. It's a niche, So we try to explain to the Red Cross and Red Crescent world through the partnership on substance abuse, how the Rome Consensus, let's say, is a tool to promote the 7 principles of the Red Cross and Red Crescent. So, and this is just an example. So I know what you mean. It's really, really a great point, and especially for a network like yours, like Youth Rise, we understand that this statement is kind of, I don't know, it's a great statement, but it's not very, let's say, accessible, for someone who is 17, 18, 19 years old. So I see what you're saying, and I totally agree with you. Yes?
Just also, I think that if you're trying to find a way to tailor the messaging to all these different groups and people who are activists in their own fields. A good way to do that is to look at the Sustainable Development Goals and linking how they won't be, each one won't be achieved if we continue the way we are. And then I think that can really get people to care, because if they see the Sustainable Development Goals are linked, and if they're working in a field where they focus in on one specific Sustainable Development Goal, then they'll be able to link that to the work that they do. And there's lots of documents on, or there's a few documents online that talk through the the war on drugs impact on Sustainable Development Goals.
Absolutely. And who goes first? Alessandro De Rossi, please.
Grazie. Qualche anno fa, nel 2004, la Libia aveva smesso di fare la guerra all'Occidente e è stata premiata dalle Nazioni Unite a presiedere la Commissione dei diritti umani. Il primo progetto che fu fatto era quello di sistemare il piano carceri. Io fui chiamato a fare quel lavoro molto interessante, perché mi confrontavo non soltanto con una problematica particolare, ma anche perché è un paese di cultura islamica, per cui era veramente importante confrontare modelli detentivi di questo genere. Dopo molto lavoro, devo dire, nel confronto con l'università, colleghi architetti libici, eccetera, riuscimmo a convincere la commissione governativa a fare anche all'interno del carcere dei luoghi dove fossero consentiti i rapporti familiari, i rapporti affettivi. È stato un lavoro, ma siamo riusciti. Poi purtroppo, vabbè, è successo quello che è successo, è sfasciato tutto, per cui è. No, mi viene in mente questo aspetto perché anche in Italia, dopo un certo numero di interventi, di anni, di dibattiti, eccetera, finalmente il discorso che riguardava i diritti umani, quindi i rapporti affettivi con la famiglia, rapporti sessuali, non abbiamo paura di questa parola, in talune carceri, questo purtroppo è il lavoro che faccio io, che mi interesso, sono stati costruiti dei piccoli moduli architettonici per consentire all'interno dell'istituzione penitenziaria degli ambienti dove è possibile appunto che i coniugi potessero incontrarsi. Mi viene in mente che cosa? E se facessimo noi un modulo per i diritti umani, per problemi collegati alla droga, un ambiente non dentro il carcere, prossimo, vicino, in modo tale che ci possa essere un'immediata possibilità di poter fare un trattamento curativo, medico, non vicino al carcere, anzi fuori dal carcere, ma comunque istituito dall'ente che appunto si occupa di queste questioni. Abbiamo sentito in queste giornate la disponibilità del Ministro dell'Interno italiano, la disponibilità del Ministero della Salute. Stamattina ha preso la parola il DAP, il Dipartimento di Amministrazione Penitenziaria, e questo è il momento per metterli alla prova. Facciamo un modulo che sia esterno al carcere, ma che abbia le caratteristiche importanti di quello che riguarda il trattamento immediato, in modo tale che si possa essere questo primo test che viene fatto come wrong consensus per quello che riguarda il discorso di protezione dalla droga e evidentemente poi l'avviamento successivo a quelle che possono essere appunto le comunità come quella appunto nella quale noi abbiamo il piacere di trovarci. Grazie.
Grazie mille Alessandro. Rispondo in italiano perché adesso mi è più facile che stai parlando in italiano. I hope you don't mind if I respond to Alessandro in Italian very quickly. È un'idea fantastica e che merita, diciamo, la giusta attenzione, anche, diciamo, gli attori ci sono. E la cosa interessante, credo, nel nostro network è che grazie anche, diciamo, al mondo di Croce Rossa e Mezzaluna Rossa riusciamo veramente a coprire tanti settori che altrimenti tra di loro non comunicherebbero, non lavorerebbero insieme. Quindi il Wrong Consensus intende essere veramente uno strumento accessibile a tutti e che possa veramente compiere delle azioni significative non solo in tema di policy, no? Ma nel settore salute, che è prioritario, nel settore diritti umani, anch'esso prioritario, e tutto il mondo poi che gira intorno a quello che abbiamo detto stamattina, la deflection, quindi è fondamentale, e appunto quello che diceva Ruby di Youth Rise, rendere il messaggio, i contenuti accessibili in modo facile, in modo diciamo che non sia riservato all'elite, a chi si occupa di drug policy e basta, ma sia uno strumento inclusivo. E quello che hai suggerito tu, mi permetto di darti del tu, è appunto no, non solo un test, ma un'evidenza che può essere accessibile, può essere uno strumento inclusivo anche in settori che apparentemente non lavorano sempre insieme, seppur allineati, no? Sugli stessi valori, sugli stessi principi, non sempre si trovano a collaborare insieme, quindi grazie per...
Aggiungo giusto un attimo,
Certo.
questo ci consentirebbe di mettere tutti insieme intorno a un tavolo il Ministero della Salute, il Ministero della Giustizia, il Ministero dell'Interno.
E la Farnesina che si è resa sempre disponibile ultimamente.
Facciamo questo modulo, non dentro il carcere, vicino al carcere. Prossimo.
Ottimo spunto, grazie mille. Joanna, please, the floor is yours.
Thank you. I'm sort of echoing a little bit what Ellie and Jamie said, that I think for us to go away and work on ideas, we need to understand what your objectives are. Mm-hmm. Is it expansion? Is it strengthening the signatories? Do you want the signatories to do something? Jamie talked about the checklist. Do you want people to be using that? So to have a clearer idea of what you want these communications to actually achieve would be great. I think another thing to consider is how much capacity you as the sort of secretariat have to centralize some of this messaging, because what you don't want is to split us into 4 regions and have 4 totally different ideas and communications, because it will confuse people. I think, if there is the capacity to centralize some of this messaging, so you take one of the days, someone comes up with an idea, and then the assets, the actual materials are coming out that then we're given instructions on, share this on this day, the frame that Jamie talked about, so that we're all doing the same thing. I think that would also strengthen what you're doing. And it may be appropriate to distribute us rather than geographically, but by focus. If you're talking about tailoring materials, we've just had human rights mentioned, workforce, we've got the harm reduction, maybe actually we could do more to help you adapt materials for our networks than we could to help you geographically. Sorry, I know I used my chance to say.
I will. It makes a lot of sense, and basically there are like different levels of engagement. Again, drug policy and humanitarian drug policy is a sort of a niche. So one of the goals is so now we know that the Rome Consensus Initiative is well known among our network. But as Jamie was explaining, we really need to get out there, meaning we know that drug policy experts know us, but we need to make sure that the advocacy plan, the future advocacy plan, will include fields and experts who are not part of our network. And another goal is to train people, because again, even within the world of the Red Cross and Red Crescent, I will repeat myself, but this is a very, drug policy is a very, very small field of interest compared to the other fields of action and of interest within the Red Cross and Red Crescent. So we need to make, again, these statements and our goals accessible, and actually one of the tools could be trainings. And of course, we don't have the capacity to train the network, but we can, of course, for example, with ISUP, you have a huge network, a huge platform, and it would be amazing if we could offer a training about humanitarian drug policy and a training about deflection on the, ISUP platform. This would be a huge step. And then, answering your questions about our capacity it's very limited. I want to be honest with you. Right now, it's very limited, and we're happy, of course, that the interest towards the Rome Consensus is growing, but at the same time, we are concerned about how do we manage this growth. Things are happening very quickly. It's all positive, feedback that we receive. Lots of people wants to know more, they ask us, how do we engage with the Rome Consensus? So the interest, the enthusiasm is very high, but at the same time, we need to be realistic. Do we have the capacity? So one of our goals is definitely, let's say, work closely to some target allies. And for example, one of the strategies that we have in mind is the ambassador program. So we identify key partners, can be regionally, can be based on the field of expertise, and then provide to the ambassadors, so just a smaller group, but very strategic, like I don't like this word, but it would be like the elite, the best of the best among our supporters and among our partners to move on and to, let's say, carry on the advocacy actions in a more strategic way. And Martin, do you want to add something about this point, or about how to engage in a more strategic way with the allies and supporters?
No, I think the comment of and proposal of Joanna have all sense, and also I want to thank to Alessandro for the proposal and intervention also. And yeah, I think also we can do some specific short actions. For example, if we can achieve that the majority of organizations, signatory organizations, communicate they engage from consensus, that will be a big step, because we have a lot of organizations. If the half or the 30% do this, it's I guess we can have more impact.
Mm-hmm. Please, I know you have a question.
Thank you very much. I'm from the international organization. I would say that I'm a guest here. I'm not part of the Rome Consensus as such, but I think that I would like to add something as a guest or intruder, if we say so.
You're a very special guest.
No, I would like to reflect on what Jamie was saying about the Human Rights Council report. Not only the report, there is several opportunity to engage with the Geneva-based institution. I looked at it that you're very much UNODC and others, but Geneva-based Human Rights Council with Office of the High Commissioner, also World Health Assembly. We have the WHO, and also one of the benefits to contribute to the report that your contribution will be posted on the UN website. It will be all the contribution which is come, we put on the website. So your information will be out there and under the umbrella of United Nations Office of the Human Rights Commissioner in our office website. And also there is a high-level panel or intersectional panel early next year before the 2024 summit, 24 midterm review in Vienna. There will be one intersectional whole-day discussion or half-day discussion in Geneva. So those even to try to find out what are the Geneva-based organization. I think you have good ally over there. Lasha lives there, so he knows. It would be good to add that one. And again, I think that last 2 days I was talking about gender perspective, gender aspect, and I would like to request particularly to add the 8th March in your list, International Women's Day on your list, and also how to bring this gender discussion more prominently through research, publication, or awareness campaign, this aspect to bring on the spot, on the ground, that would be. And at the page 17, because I'm mentioning this international level because you're dividing the working group in geographical. So I would like to remind that. Just you on the page 17, it's really good to see that all UN agencies you have included. Maybe you can think about my office as well. Yes. Thank you very much.
Thank you, Zaved. Thank you so much. I mean, this is a great feedback, and it's actually huge to us. So we're so glad you're here, and we're so glad you are, I mean, interested in first learning more, but also you are, I mean, this is the magic. I mean, the magic is happening during this event. And that's what we were waiting for so long. So since 2020, we were really waiting to have the chance to, meet people like you, like everyone who is here today, and to have this conversation, this exchange, because that's what we really need in order to, move forward. So thank you so much. And yes, who goes first? Michelle, please. Thank you.
Sure. I'm really appreciating this conversation also. A couple of ideas. So in addition to looking at the plan, I'm pulling out the Rome Consensus. And it seemed like 2 goals for this would be to continue to expand the organizations that are aware of the Rome Consensus so it can impact. But then I'm also a bit, like if there are 14 things we say we want to see done, then let's see them get done. And so having a way where people can maybe add to the map where projects are taking place that fulfill the Rome Consensus, or, the ranking, whatever you do. I kind of like promoting and really illustrating not only the people that stand behind it, but they're actually putting their actions where their words are, and they're making things happen. Kind of a no expense thing that you could do is to have some awards. So have an annual award where you recognize someone. And the other thing is when you're looking at expanding access, I'm looking, because I do a lot in drug policy, and people get in their cliques, right? So there are organizations that talk a lot about drug policy that don't turn to the IOs that you have listed for information, but they should. And so that might be something too, as you talk to your ambassadors, identify who are the national partners, the regional partners, who are those governments listening to and turning to for advice. Sometimes it's more internationally, but sometimes it's more internally. So I'm thinking of justice organizations or healthcare organizations that absolutely meet the deliverables of the Rome Consensus. And so that might be another way that you can expand, because again, you want to reach new audiences that are doing this, but they haven't seen it articulated this way.
Thank you. If I may say something before I give the floor to Professor Villanova, there are a lot of organizations out there that basically they are already implementing humanitarian drug policy or deflection. They just call it in a different way. So that's why we want to expand the network and, let's say, get out of the drug policy bubble, because it's important that we are inclusive in that way. So thank you, Michelle, for your feedback.